Hello, everyone. So we are returning back again after the break. I hope you had a nice break after our first interesting session. And we have a very um, nice and a very interesting session again with a very exceptional speaker, Dr. Kamila. Actually, me, I'm looking forward to it. And I hope you as well, I'm sure that. Juan, our regional ambassador of Americas region, the floor is yours to moderate the session.
Thank you very much, Maya. And yes, I want to appreciate Dr. Kamila for accepting our invitation of being here in IADS Americas month for this session of the webinar. This is our last session, so I hope you can enjoy this and learn a lot from her because I know this will be a super nice and interesting talk that we can learn a lot with it. So super appreciate your participation, Dr. Camila, and you can start. Thank you.
Thank you, Juan, and thank you, Marian, for the introduction. I am actually very happy to do this presentation. I know about IADS since I was in the undergraduate, so I am honored to stay here with all of you. And today's topic, maybe it's not very common actually when I shared the topic of my presentation with one of the organizers. He told me, oh, actually, we have never talked about this, so I hope that you enjoy it. I hope that you can learn a little bit more about economic evaluations, dental public health. So I'm going to start sharing my screen to start this presentation. And please, any question that you have, feel free to write it in the comments, in the chat. And I am also speaking Spanish. I am from Peru, actually. So if you have any question in Spanish, feel free to write it in the chat. I will be happy to answer it too. Okay, so I'm going to share my slides. And please, Juan, let me know if you can see the slides.
Yeah, we can see them. It's perfect.
So, all right, so the topic for today is cost effectiveness analysis of pediatric dental interventions, challenges and recommendations. My name is Kamila Sihuay-Torres. As I said before, I am from Peru, but currently I am in Canada doing the PhD in dental public health at the University of Toronto. So I would like to talk a little bit about me and why this topic is very important, like personally, and also because I think that regarding which path all of you take, like after your undergraduate studies, I think that understanding a little bit more about how to interpret the results of these type of studies will help you a lot. If you are a clinician, if you are a professor, if you would like to work in dental public health too, if you would like to do or have promotion activities in that community, also this will help you a lot. So talking a little bit more about me and why I am very interested in this topic, and I hope that also I can do that. All of you are interested too in conducting economic evaluation. So I am from Peru. I am the oldest sister of 4 siblings. Here is some pictures of my family. And since I was in school, I was very interested in doing community activities. I traveled a lot to do campaigns in rural communities in Peru, and I was aware about all of these inequities in many parts of my country. So I decided to study dentistry basically because I wanted to do something for most of these communities, but related with healthcare services. And also, well, my parents are dentists too. They have their dental office at the same at our house. So I grow in a dental office practically. I'm still not sure if that influenced on my decision, but well, And another important person also in my life is my husband. He's also a dental public health researcher. We are doing the PhD together here in the University of Toronto. So this is my faculty. I studied in the Universidad Nacional Mayor de San Marcos in Peru. And as I told you, I wanted something that I really wanted to do in the undergraduate was a lot of activities in the community. So, oh my God, I did many oral health promotion, oral health education. I love to do this type of theaters. I used to act as a tooth. It was very funny. I really enjoy all of that. And we also created the Scientific Society of Dental Students to continue doing all of these activities in school-based programs. So yeah, and all of these things increase my passion of dental public health. So I decided to do the master's in public health in the same university. And at the same time, I started working in an NGO, doing oral health education in some low-income populations in Lima. And I noticed a lot of, it was a challenge because the main focus of these activities were oral health education. But as you can see, not many parents assisted to my activities. And so when we decided to go to the homes of the children, was when we saw all of the problems. So we saw many children without their parents. Most of their parents had to work, so the children were alone at their houses. We saw a lot of dental caries disease. Also, most of the parents couldn't assist to these oral health education activities because they didn't have time. They have to carry all their children all the time. So many social determinants didn't affect the access of these families for my oral health education activities. And so that made me question about if could health education alone resolve this problem? And also, could it cause more inequities among the lowest income children? Because the lowest income children were not able to assist these oral health education activities. And how could we improve access to oral healthcare services? So trying to think how can I resolve these problems made me continue pursuing my studies in dental public health. So that's why I decided to start a PhD. I am currently in my second year of the PhD. These are some of the very nice memories of my first year during the PhD. I created a very nice family with my partners at the lab. And I also, during my first year, I did a course about health economics here in the Institute of Health Policy Management and Evaluation. Some of the classes were like, oh my God, what is this? I don't understand anything, but doing a research in this course allowed me to understand better what are economic evaluations and why are so important for knowing how to use our available resources in conducting oral health interventions more in an efficient and effective manner. So yeah, also here is my supervisor. I am very grateful with Dr. Irene Lawrence. She also provided me many lessons, knowledges to create my proposal. And here's my husband. This was my first time looking at the snow. I was super excited. And another important thing during this year was the creation of our study group in dental public health. So if any of you is interested in this topic in dental public health, please follow our page in Instagram. It's called Cali Peru. And we can continue learning about dental public health issues and topics in the discussion forums that we are organizing. Okay, so now it's your turn. I would like to know a little bit more about all of you. So please write in the chat, where are you from? From which country are you joining this webinar. So I'm going to see the chat now to see where are you come from. Guatemala, it's Juan. Oh, that is great. So what about the others? Peru. Hi, Carla. Carla is also part of our study group in dental public health. So what about the others? Guatemala, Palestine. Oh, that is great. Okay. Sudan. Hi, San. Ecuador. And I am asking this because most of the economic evaluations are, well, actually, all the economic evaluations are very influenced about the oral healthcare system of the country. Then I will explain it a little bit better, but that's why I'm asking where are you from, because I would love to learn a little bit more about your oral healthcare systems. Okay, so from Ecuador, Sudan, Egypt, Peru. Okay, that is great. And I think that all of you are undergraduate students, right? So in what year of undergraduate studies are you in? Are you finishing undergrad? Are you in the last years, at the beginning? And also, I would like to know if have you ever heard about dental public health? I know that most of the curriculum of dentistry is focused on the clinical aspects like pediatric dentistry, implantology, rehabilitation, but have you ever heard about dental public health before? And also, have you ever heard about cost effectiveness analysis? Please write on the chat in what year of undergrad are you, and if have you ever heard about these two topics? Okay, let's see. Yeah, I will. Juan, for example. Okay, Juan, finishing undergrad. And have you ever heard about these topics, Juan?
Actually, I have to be honest, Camila. Public health, well, dental public health here in Guatemala is not that important, I could say. They don't pay that much importance to it. So no, I have not heard about this topic.
Yeah, that is something that is very common. I also didn't know about the existence of dental public health during my undergraduate. Okay, so Carla said last year, I've never heard about the last topic. Yeah, I can imagine. So it's good to know because to know like how deep I can go in this webinar, but as Juan said, dental public health is not very common, unfortunately, and it's very needed because we are used to do a lot of campaigns, a lot of oral health promotion activities. We have, in most of the universities, we have courses about preventive dentistry, but if we are not considering some aspects of which dental interventions we have to use or will improve the situation of the people that we are reaching. So we may cause more damage than something good. We could increase the inequities and then decrease it. So that's why it's important. Okay, so today, what are we going to talk about today? So first, I divided this presentation into 3 parts. So first, we are going to talk about what are economic evaluations and why we should care about them. Then we will talk about the current evidence of economic evaluations of pediatric dental interventions and how to understand their results. And finally, we will talk about challenges and recommendations in conducting and or understanding economic evaluations. So our goal is to understand the importance of conducting economic evaluations in pediatric dentistry and interpret the results of the available scientific evidence. Okay, so let's start with the first part. What are economic evaluations and why we should care about them? All right, another question for you. Which type of dentist are you or would you like to be? after your undergrad? Option A, would you like to be a clinician with a lot of patients and a successful dental office? Or option B, would you like to be a professor, like doing research with a lab or with more students? Or option C, would you like to be advisor for these policies or for decision-making activities in oral health or global oral health? So you can choose one or two or three options. So let me know in the chat. I personally would like to, after my PhD, would like to be option B and C. I was talking with my husband yesterday, and we were thinking, oh, we would love to be that three, but it's impossible sometimes. So, which option would you like to be? Let me know in the chat. Okay, Juan said option A and B, a clinician and a professor. Yeah, that sounds great, actually. Many of the professors are also clinicians. Harum said option A, a clinician with a very successful dental office. And then Valeria said A and C. That is great, Valeria. Julia said A and C. Julio said A and maybe then C. Okay, that is good. So we can be one, two, or three, but I am asking this because whichever path you take, this session is very important for you, as I mentioned at the beginning. And now I would like to know, because all of you come from different countries and different contexts, how is oral healthcare paid for in your country? So patients or their private insurance pay for most of their dental treatments. They pay it out of pocket. So that means like the oral healthcare system is mostly private. Or option two, the government covers some basic treatments for a group of people. For example, the government or the main insurances cover treatments for children, only for children. Or the number three, the government covers all the basic dental treatments for everybody. So everybody have at least some dental treatments by free. So let's see. I'm going to see the chat. I'm very curious about this. How to know a little bit about your healthcare or a healthcare system. So option A, no, well, in this case, 1, 2, or 3. Harun said A. Well, I guess number 1. Juan said 1. So patients or their private insurance pay for most of their dental treatments. Okay. 1. Most Guatemalan patients paid out of pocket. Yeah. Maria Teresa said 1. Julio said number 2. Okay. And knowing how the oral healthcare system in our country is relevant. And while we are discussing this webinar, you will understand why. And sometimes, actually, most of the people don't care about how everything works. And actually, now I'm going to explain what is happening now. Have you seen this global oral health status report that was published the last year? This was something very important, especially because provided us an idea of how the universal health coverage regarding oral health care is going on, like what is happening now, like how many people are having oral health care coverage worldwide. And some of the things that is mentioned in this report is that the global burden of disease from untreated oral diseases and conditions, the continuing lack of coverage and affordability of essential oral health care for large segments of the world's population, and growing inequalities are all clear signs of the low public health priority given to oral health. And that is something really sad. And if we look at the what is happening with untreated dental caries in deciduous teeth, over 532 million children are affected by untreated dental caries in deciduous teeth. Here we can see the map. This map is from this report that I showed you before. And dental caries impact children's school performance, quality of life, adults' productivity at work, and the whole healthcare system. For example, in 2015, untreated caries in deciduous teeth caused, well, here we have in billions, but that is like more than $900 million in global productivity losses. So this is impacting a lot, and we have this problem since many years ago. And despite of the fact that various strategies have been used to prevent and control the progression of dental caries in children, we still don't know which strategies have proven to be effective in reducing the occurrence of caries. And also in terms of cost, like there is limited evidence in which intervention is the most efficient in terms of costs. And for example, these are two papers related with the universal health care coverage. And well, and then you will understand why talking about this universal health coverage is important. But something like to define it a little bit is, so this means that every individual has access to essential quality health services that respond to their needs and which they can use without suffering financial hardship. And I am mentioning this because, as I told you before, if the governments or the decision makers, the policy makers doesn't know which of these dental interventions are more effective and efficient at the same time, they could provide some treatments that at the end are more costly, and at the end we are not solving the problem that has been happening since many years ago. And we have this 2030 agenda, and we are like 7 years from this goal to increase the universal health coverage in our healthcare. But there are many challenges still, and well, these two papers describe it a little bit more, all of that. And this other paper also is tried to explain how minimal intervention dentistry can help tackling the global burden of untreated dental caries in a cost-effective manner. So having an understanding of economic evaluations can help us to also reach this goal of having more access to oral healthcare worldwide. So one of the quotes that I really like it from one of the papers that I showed you in the previous slide is, there is no health without oral health, and there is no universal health coverage without oral health care. So this is the expectation. So having 75% of the global population with essential oral health care coverage by 2030. But the reality is that unfortunately, less than 30% of the global population has essential oral healthcare coverage. And as you mentioned in the chat before, most of your oral healthcare systems are mostly private. So most of the patients have to pay out of pocket. And sometimes they will prefer other options than their teeth, right? So you have a choice every day. Life is made of decisions. For example, you have a choice every day. You can choose every morning whether you will be depressed and miserable or whether you will be happy. Or you can choose between restore your tooth decay with a certain amount of money, or having a tooth therapy that here in Canada, I think that it costs like $600, or having beautiful nails. Or even another thing like having some money for traveling. Or that even be worse, because some people actually have to choose between restoring their teeth or saving their teeth and having something to eat for their families. So could be simple or more complex like this. And so choices are influenced by our available resources. And most of the time, these resources are related with money, with how much it will cost. But not only money, also about time. Time is a very important resource. We used to say, oh, I don't have time for this. I don't have time for this. So time is also an important resource. But unfortunately, resources are scarce and limited. We don't have money for everything that we would love to have. And also choices are influenced by the expected consequences of our decision. So what we will obtain by deciding to restore our teeth, we will stop the pain, we will have again a beautiful teeth. So these consequences could be like in an individual level. So what will be the consequence for you? So also could be consequences in your family, like what will happen if I spend $600 for a poop therapy, or and I avoid like buying like this food or this educational material for my children. No, so the consequences can impact also your family and can impact also the society. So these are two of the goals for the United Nations 2030 agenda, like having good health and well-being for most of the people, and also end the poverty. And I added these two pictures about justice and social, that means about social justice. So supposedly most of the governments also make decisions about how can we improve the social justice in our population. So if we would like to know which dental intervention gives more well-being and at what cost, or in other words, which dental intervention is more cost-effective, economic evaluations play an important role by answering this question. We have here two interventions. So, for example, intervention A could be more costly than intervention B, and also intervention B could increase the well-being, could increase more the well-being than intervention A. So economic evaluations are very important to provide us these answers. And also economic evaluations inform policymakers in allocating these scarce and limited resources that all of us have more efficiently. So there are three main types of economic evaluations. We used to call it full economic evaluations. There are the cost effectiveness analysis, the cost utility analysis, and cost benefit analysis. So the difference between these three types of economic evaluations are related with the type of consequence that they would use in their analysis. So for example, for cost effectiveness, we consider the cost and the consequence. The effectiveness could be, for example, caries increment, or could be, or a health related quality of life. In cost utility and cost benefit, we use two different types of consequences that are more generalizable among different interventions for different fields. For example, in cost utility, we use the quality adjusted life years, which is known as QALYs. The QALYs is a universal measure of quality of life. And the importance of using that is that you can compare, for example, a dental intervention with an intervention for diabetes in children, for example. So having a common consequence between different interventions allow us to make these broader comparisons. And in cost benefit, the same, that this common consequences is called monetary units. So we quantify these consequences in terms of how much it costs, or how much the people is willingness to pay for having this consequence. So basically, today we're going to focus more on the cost effectiveness analysis, but I will show you a little bit of the other two. So basically, the results of these three types of economic evaluations inform about how much the government or who pay for the treatment or for the intervention will invest or save, considering the consequences of this intervention compared to another. So we used to compare two or more interventions in terms of costs and their consequences. Okay, so why are economic evaluations important? In the case that you choose to be a clinician, Economic evaluations will provide effective treatments without impacting the patient's finances in a short or long term, in the case that the patient is who pays out of pocket for their treatments. Also, by providing these effective and efficient treatments, you will improve the quality of oral healthcare in your dental office, that consequently will allow you to have more happy patients. And finally, you can save time and resources by providing better oral healthcare treatments to your patients. Remember that time is another important resource. And imagine that there is a treatment that you can perform in, I don't know, 15 minutes. For example, silver diamond fluoride is super easy to apply. We know that it's effective. You can apply it like in 10 minutes maybe, compared to a conventional restoration that you have to isolate the tooth, and maybe you spend like 1 hour, and also it's more costly. So, well, this is like in general why economic evaluations are important if you decide to be a clinician dentist. Or if you choose to be a professor, okay, economic evaluations, and if you conduct this type of studies, you will contribute to advocating universal oral healthcare coverage. And this is a priority now. We need more evidence to support which interventions we should include in this basic healthcare provision or healthcare treatments. And also you will have the opportunity of a multidisciplinary work. You will have networking opportunities, because conducting this type of for conducting this type of studies, you need a team from different fields. And this is super exciting. Actually, this is super interesting. You learn a lot from other fields of studies. And finally, there are many funding opportunities for conducting economic evaluations. And finally, if you choose to be a consultant for decision making in your country or in an international setting, such as the World Health Organization, so you will know how to use the available and limited resources in an effective and efficient manner. So more people can benefit from the interventions, because you will have more resources to spend in other type of interventions, and you will advocate for social justice. Finally, advocate for reaching the 2030 United Nations Sustainable Development Goals. That is our priority now. Okay, so now let's have fun doing an example of a cost-effectiveness analysis. It's so exciting for me. I was so excited when I finally understood how to do this. It's not too difficult as we used to think, but I hope that you can understand it. And if not, let me know in the comments so I can repeat it again. Okay, so, but before we do the example, it's important to understand this formula. So you may think, oh, what is this? Okay, most of the cost effectiveness analysis have to conduct this formula. It's called the ICER, or the incremental cost effectiveness ratio, where we compare two interventions, I told you, in terms of cost and the effectiveness. So we measure how much cost both interventions, what is the difference of the interventions in terms of cost, and then what is the difference of the interventions in terms of the effectiveness, the outcome that we are looking for. And we will have a ratio. So with this ratio, for example, we could have a result like this. With intervention A, the government will spend $200 per dental surgery averted. So we have the cost and the effectiveness. Okay, but to understand it a little bit better, let's do the example. So imagine that you are a pediatric dentist and you have a 6-year-old child, a 6-year-old patient with tooth decay in the first permanent molar, which is indenting, a little bit of pain, but it's still the tooth doesn't need a pulp therapy. So you have two choices. Remember that our life is made of choices. So I'm sorry, here I got confused in the numbers, but one of the choices is a traumatic restorative technique with glass ionomer, and another option is the conventional composite restoration. Okay, so let's see that the cost of the ART is $80, and the cost of the conventional composite is $100. and effectiveness regarding the tooth loss averted for ART is 85%, and for the conventional composite restoration is 90%. These numbers are fake. It's only for the example, but it's not based in any article. So something that is very important is to consider are these 3 bullets. So first, it's something that we call it in economic evaluation, time horizon. The time horizon is how much time is effectiveness expected. 2 years. So after how much time we will see this effectiveness, that tooth loss, in 2 years, in 5 years, in 10 years, in 30 years. So it's important to have in mind this time horizon. Another thing that is important is which type of costs am I considering? Direct costs, indirect costs, or both. So direct costs are only related with the provision of the dental treatment. So for example, $80 because we are considering only the cost of the dental materials, the cost of the payment of the dentist. So costs that are only related with the intervention. And indirect costs are costs related with, for example, how much time the caregiver is spending in the appointment for the child, how much cost this time, how much cost the transportation from the home to the dental office. So it's important to think about which type of cost we are considering. And finally, the perspective. And this is related with who is paying this cost, the patient, the family, the dentist, the insurance, the government, the society, and that will depend on the type of cost that we are considering for the analysis. So let's see if we are having these values. So as I said, we have to calculate the ISR. So it's a fraction, a very easy fraction. So we first look at the cost and then the effectiveness. So then we have this. So we could have this result that, for example, that if the patient is who paid only for the direct cost, the cost of the treatment, we could say that the patient could invest only $4 per 1 tooth loss averted, per saving 1 tooth, something like that. But this could change a little bit more if we consider, for example, a lifetime horizon. That means like if we see at all of the consequences or the tooth loss aversions over the life of this person, and also if we consider other direct and indirect costs. So the cost of, for example, one of these interventions could be much higher because we are considering different perspective and different type of cost. So let's see that, for example, by doing a conventional composite restoration, at the end, because it's a more invasive treatment, the child, when they have like 20 years, they need then a pulp therapy, and then the pulp therapy doesn't work, and they lose the teeth, and they need an implant, and so we could have a much higher cost considering all of these factors. And the ISR obviously can change, and we can see more differences in the results. I really recommend you this book. It's called Economic Evaluation in Child Health. And I wanted to show you this part of the book because this helps us to know, okay, with these results, then how can we take the decision? So, because, okay, one intervention could be more effective and the other less costly. So this table help to understand how to make these decisions, especially if you would like to be a policymaker. So only, for example, if you are organizing an oral healthcare or a health promotion activity in your community, how can you decide, okay, which intervention I will include in my campaign or in the activities that I would like to conduct? So if your intervention is, so the new intervention that you are proposing is more effective and also you save money, that is ideal. So if the new intervention is more effective and less costly, that is the ideal situation. But if the effectiveness could be like also both interventions could have similar effectiveness, but one is less costly, you still choose this new intervention that has a similar effectiveness. And also in this B and 1, so that means that the new intervention is more effective but more costly, you can also decide for this intervention. Okay, so let's go for the part 2. So which is the current evidence of economic evaluations of pediatric dental intervention? But before I continue, I only would like to know if you have any question. Everything is clear. Did you understand the ICER? So for me, at the beginning, it was complicated to understand, but I'm trying to do it a little bit more simple. But yeah. So let me know in the chat if everything is okay. Okay. Okay, so in this part, I'm going to show you some of the results of my scoping review, which is like my first PhD baby, the first chapter of my PhD dissertation, which I am very excited to finish it. So I did a scoping review during this first year, basically because I wanted to identify and map the published literature and economic evaluations of preventive and non-invasive interventions for dental caries in children under 12 years of age and describe their methodological aspects. So when I looked in the literature, we searched on all of these databases, and at the beginning we found like more than 2,000 articles. We use Covidence, by the way, we use Covidence, a software that helps us a lot in doing this scoping review. So at the end, after the screening process, after careful review each of the paper, we included only 56 economic evaluations. And this is something interesting because when we look at the distribution of these economic evaluations by country, we can see that most of the economic evaluations in children were conducted in the US. Here, the green part, the darker green part, 16 studies in the US. Then we have Australia and Chile with 6 studies. No, I'm sorry, only Australia. Australia with 6 studies, then Chile with 5. Then we have Brazil, United Kingdom with 4 studies. In Canada, we only had 2 studies. Then the countries in red only had 1 study. These countries were, let me check here, Finland, India, Iran, the Republic of Ireland, Japan, Netherlands, Scotland, and Sudan. So we can see that there is a lack of economic evaluations in most of the countries. And when we review the distribution of these economic evaluations by year, like we can see that we started having economic evaluation since 1980, but in the last 20 years or less, we started having more of these type of studies, but most of them are only focused on cost effectiveness analysis, which is the light blue bar. But we are having an increment of this type of studies. But as we can see before, most of these studies are conducted only in one of the countries. For example, the cost utility analysis and cost benefit analysis, which are, I think, one of the most important, were conducted only in Australia, UK, and Chile, one in the United States. And the cost benefit analysis in Australia, Sweden, UK, Japan, and USA. And here we can see also which are the knowledge gaps by looking at which were the less common type of economic evaluations. And we saw that there were less studies, less economic evaluations that included non-invasive dental strategies, and only 2 with silver diamine fluoride. Actually, well, SDF is something very new, but we still need more information about that. And most of the outcomes, most of the consequences that the studies included in their analysis were clinical outcomes. And do you know what? There is a problem with this, because if are important, but if we would like to compare, or that policymakers understand this clinical dental outcome, sometimes it's very complicated for them. And if we would like to compare our dental interventions with interventions in other fields, we will not be able to do that, because these are not generalizable outcomes. And also, more related with like specific clinical outcomes that also doesn't show the quality of life. So how these treatments are impacting the quality of life of patients. So at the end, which dental intervention is better for the pediatric population? Fluoride varnish, sealants, ART, SDF, dental education. And unfortunately, we cannot say now, in terms of cost and effectiveness, which is the better. Most of the studies were conducted about fluoride varnish, sealants. We also saw that non-invasive therapies such as like ART are more cost effective, but it's a little bit complicated to provide like a conclusion, because there is a lack of high quality economic evaluations in dentistry, and more specifically in child oral health, because there are a lot of inconsistencies in the reporting and conducting economic evaluations, poor research methods. Most economic evaluations are focused only on clinical outcomes. And for that reason, systematic reviews cannot provide a clear conclusion to support or not a certain intervention. If we are talking about economic evaluations, about which is the most cost effective. And I would like to tell you an experience that I had in the last IADR. I had opportunity to present the results of this study that I conducted also during my first year in this course that I told you about economic evaluation. So I did a cost utility of fluoride varnish and dental counseling in indigenous communities here in Canada. So I did this study with my supervisor. She did an incredible randomized control trial many years ago about these 2 interventions in many indigenous communities. It was one of the largest RCTs here in Canada. So I had opportunity to use this data to analyze the economic part, and I found that there isn't too much difference in terms of the effectiveness, but in terms of costs, yes. So that demonstrated that fluoride varnish with dental concealing were more cost effective in terms of utility values, which is a universal quality of life outcome. But when I was explaining my results, so excited about this, and we had time for questions, one of the participants from, I don't remember which country it was, but one of the participants said, "Oh, well, but I don't know, why did you find these results if in many of the studies that we conducted in my country, we saw that fluoride varnish is not more cost effective because we consider this and this." And well, I don't exactly remember what did I answer, but something that is very important was that, and that also made me reflect a lot on this, is that results may vary a lot according to the perspective that we're taking in our analysis and how the oral healthcare system works in our country. So it's very important to understand how the oral healthcare system works in the setting that we are conducting the economic evaluations. Also, when we interpret the results of the different economic evaluations that are already published, we have to consider these aspects, because we could find in some papers that, okay, this intervention is more cost effective than this, but in which settings, in which context? So that will influence a lot the results of this type of studies. So that's why it's very important to conduct this type of economic evaluations in more countries, because we don't have enough evidence per country. Okay, so we will finish this presentation. I'm not sure if I'm good with the time, but we will finish by mentioning some challenges and recommendations in conducting and or understanding economic evaluations. So first, let's talk about the challenges, which are a lot, but I will make some emphasis in some challenges. So first, this is an important paper. It was published the last year, and it was an updating of the Consolidated Health Economic Evaluation Reporting Standards, the CHEERS, the famous CHEERS 2022. So this is a checklist that has 28 items to understand the reporting of the economic evaluation. So how good, how can we report our economic evaluation? How can we report the results, the methods of our economic evaluation? Maybe you are familiar with Prisma, Consort, which are for other type of studies, but when we are talking about economic evaluations, CHEERS is the gold standard to know how to conduct and report this type of studies. And also when we are reading economic evaluations, we have to try to identify these items to know not the quality but of the economic evaluation, but yes, how is the methodology, if it was clear and if we can trust also in the results. So this is part of my scoping review. So here, what I was trying to show, what I'm trying to show is like how is the proportion of items reported according to the CHEERS 2022 checklist of the 56 economic evaluations that I included in my scoping review. As you can see, most of the items are related with the methodology and then the results. The new items in comparison with the previous CHEERS were the items with the star icon are related to the health economic analysis plan, characterizing distributional effects. This one, the number 21, is very important because it's about how we approach or engage with the community to conduct our economic evaluation. And we can see that these items with the red box were the less reported. The orange bar means that were items not reported, or proportions of items not reported. So the items regarding the publication of the health economic analysis plan, about the characterizing heterogeneity and distributional effects, were the one of the less reported. And this one, that worry a lot, concern me a lot, because this item regarding how are we involving the community while we are conducting economic evaluations, any of the articles, any of the previous studies reported anything about this important item. So consequently, in the results, they didn't report also the effect of this engagement with the community in the results. Okay, so one of the challenges, before I'm going with this, one of the challenges obviously is trying to consider all of these items, and for that we have to work with a multidisciplinary team. There is only a PhD of health economic evaluations, so we need to interact with people outside the dentistry field to conduct this type of studies, because we have to know many of different type of analysis to be able to conduct a high quality economic evaluation. Another challenge that is more specifically with the population that we are considering is regarding the time horizon that we will consider, the outcomes, because pediatric populations are complex. And if we talk about teeth and the dentition, is more complex because they are going through a development, and there are different characteristics in different stages of their life. So this is something that also we have to think a lot and justify why we are considering this time horizon, if there are enough evidence, scientific evidence of measuring the effectiveness of certain intervention over this period of time. So this is another challenge when we are doing economic evaluations in children. And there are more, but basically only if we are talking a cost effectiveness, this is something important to think. And finally, the recommendations. And here I would like to do this calls to action. First, that is very important to understand or promote the use of the cheers, especially the last edition of the cheers at 2022. If you will conduct this type of a study, it's important that you are familiar with this. And the same as we do with the RCTs, with the randomized controlled trials, we have to also publish the protocol of our economic evaluations to do a more transparent work. And the third bullet also is very important. We have to adopt a community-based participatory research approach. We have to consider the community while we are doing this economic evaluation. Actually, as part of my PhD, that is something that I am trying to develop. I am working with indigenous communities here in Canada. I did my protocol with the community partners. It was a challenge, but it's something that is necessary. It's needed because we have to consider outcomes that are that the community wants, not the outcomes that or the consequences that we think that the community is interested. So we need this engagement with the community to understand their needs and what will we consider in most of the analysis of these studies. Also, it's important to include quality of life outcomes, not only clinical outcomes. So for doing that, also conducting cost utility and cost benefit analysis is important. We have very limited evidence of this type of studies, and it's not too complicated, but we need some knowledge before conducting all of that. Also, it's important to explore non-invasive interventions as cost-saving alternative. We need more evidence on that. The small evidence that we already have demonstrated that these type of interventions are more cost-effective, so are important, because especially now that we are advocating for oral health universal healthcare coverage. Then provide more training on sensitivity and subgroup analysis. These two types of analysis was the most complex to understand for me, but it's not impossible. Anything is impossible to learn. So we're able to learn whatever we want, but we have to search these learning opportunities to learn more about more methodologies while we are conducting these type of studies. And as I told you before, understand the healthcare system first is necessary if we are thinking about this type of studies, and also if we are looking at the results of a paper, we have to ask or review, okay, which is the setting of this study, where they conducted the research. And finally, seek academic collaboration outside dentistry. It's also very important. Okay, here I included a lot of resources for you, so please scan this QR code. I added most of the papers that I show you, also the cheers, and I will continue updating it after this presentation. But if you are interested in doing economic evaluation, in understanding more about this, please scan that QR code. I hope that all of these resources can be helpful for you. So our goal was to understand the importance of conducting economic evaluations in pediatric dentistry and interpret the results of the available scientific evidence. So I hope that all of you now are more aware about this type of studies, that you are aware about the importance, and also that you can have an idea of how to understand the results of the available evidence. So some of the key messages that I would like to say before I finish the presentation is economic evaluations help in making better decisions on how to use our limited and scarce resources in an effective and efficient manner. Unfortunately, there is a lack of high-quality economic evaluations in pediatric dentistry. And for that reason, it's very important to understand it and to promote the use of this methodology in research. And finally, it's important to promote the use of the current international guidelines and tools to conduct and interpret the results of economic evaluations. For example, CHEERS 2022, very important. I included the CHEERS in the link that I showed you before. And well, I would like to finish with this quote that I think that is very important. Achieving the highest attainable standard of oral health is a fundamental right of every human being. And this statement means that oral health is a public good and that achieving oral health is therefore also a public responsibility. All of us are responsible for advocating for a better quality of oral health care, for universal access to oral health care. Okay, thank you so much. I'm very happy to do for doing this presentation with all of you. This is my email, my social media. If you have any question after this webinar, I will be happy to talk with all of you. So thank you. I hope that everything was clear. And if you have any question now, and if we have still time, we can discuss about all of that now. Thank you. All right, I'm going to stop sharing.
Dr. Kamila, thank you so much for your great webinar. Actually, I really enjoyed, and for a second, I said, thanks God that we made it in English, so to understand it actually. So thank you so much for your effort. Thank you so much for accepting our invitation, and thank you for highlighting how important is the dental public health is. And we in IADS, we usually do some webinars and we do activities for enhancing the understanding of the importance of the public health as young generation, because we are the future of dental community. So we really appreciate your efforts, and I'm sure that our attendees as well enjoyed your session.
Oh, you're welcome.
So what a great end for our America's webinar month. Thank you so much.
No, you're welcome. Thank you for the invitation and congratulations for all the amazing work that IADS is doing worldwide. I really admire all the work, the networking that you are creating between students from different parts of the world. I think that is something very important. So congratulations for organizing also all of these webinars. I hope that I can provide some knowledge in this session, but I will be very happy to answer all of your questions after the webinar. You have my email, my social media. So if one of you are more interested about this topic, please don't feel free to reach me out and yeah. So thank you for that.
Thank you so much. Thank you so much, and hope to see you again soon.
Yeah, me too. I hope to see all of you again. Thank you.
Thank you so much.
Yeah, thank you so much, Dr. Kamila, because I think public health is so important, and actually it's more important for us that we live in countries where public health is not that important, or they don't pay that much attention to it. So we as dentists, we need to focus on that. And it's incredible because if we ask someone here what is public health, uh, they will not get a right answer, or maybe they will be confused. A lot of people don't know really what public health is. So I really appreciate it. I learned a lot from today's webinar. Really, trust me. I'm getting more interested in public health. So I really appreciate for your time, for your webinar. And I'm sure we will see each other very soon.
That is great. That is amazing. No, thank you, Juan, too. And yeah, let's continue advocating for dental public health. I told you also that I have an study group in dental public health. So if you would like to join our discussion forums, I will be very happy to share all of that with all of you too. So yeah, thank you.
Thank you
All
so
right.
much, Maria.
I think that not sure if we still have time for questions, but only let me know. Maybe if
This is
not,
time. Yeah, this is time for questions, but I don't know if anyone has one question. If not, we can finish the session.
all right. Yeah.
Okay, perfect. So thank you very much. Muchas gracias, Camila. And
Muchas
I hope you have a nice
gracias.
day.
No, gracias también y gracias a los que se han conectado de países que hablan español, de Perú. Me da mucha alegría. También pregúntenme en español por correo, por las redes sociales. Yo feliz de responderles en español. Okay.
Gracias, Camila.
So if we don't have any other question, I think that we can finish the session. I will be happy to see all of you again soon. Nothing. Thank you so much for everything.
I'm sure we will, Camila. Okay, bye-bye. Have a good day.
Bye. Bye, everybody.
Bye bye.